Welcome to Music Meditation. This is your brain on bass. The 40 Hz pitch can be heard in the opening gong, the background double bass immersion, and the exit music. More information can be found at www.musicmeditation.ca. This episode is called Non-Invasive, Non-Chemical. Medicalization means to make medical, or more specifically, the process by which previously non-medical problems become defined and treated as medical problems, usually as diseases or disorders. Wikipedia describes medicalization as the process by which human conditions and problems come to be defined and treated as medical conditions, and thus become the subject of medical study, diagnosis, prevention, or treatment. Medicalization can be driven by new evidence or hypotheses about conditions, by changing social attitudes or economic considerations, or by the development of new medications or treatments. Medicalization can be very positive and can be linked to the progress made in the prevention of diseases like diphtheria and polio, and the motivation for research into many of the vaccines delivered to children worldwide. The progressive medicalization of common human conditions has successfully eliminated many life-threatening diseases and greatly reduced the incidence of others. But medicalization can also have a negative connotation when it is used to exploit vulnerable segments of the population. It is often referred to as disease-mongering. Marketing departments are well aware of how pressing the emotional buttons of fear and hope can drive interest and ultimately sales in any market promotion. Creating a perceived need for a product is an essential part of all successful campaigns, and the ethical ramifications can be significant when solutions are driven by financial reward rather than improved health. As previously discussed, the healthcare industry is struggling to cope with soaring costs in hospitals, drugs, and doctors. The concept of basic health care for all seems elusive, and the marketing and lobbying efforts of the pharmaceutical industry can be, at times, clouded and deceptive. One of the objectives of this podcast series is to promote the support of music and meditation in the healthcare industry. The expression paradigm shift was a well-used business term during the 1990s. A concept originally attributed to philosopher Thomas Kuhn, it refers to an important change that happens when the usual way of thinking about or doing something is replaced by a new and different way. The problems facing the healthcare industry need reframing. The existing infrastructure is focused less on patient care and more on perpetuating a grandfathered legacy of corporate profitability. The framing device proposed here is driven by the needs of the customer. Current medical interventions see us as bags of symptoms rather than evolving individuals with unique personal needs. Unfortunately, many current healthcare solutions address symptoms only and not the root cause of ailments. For example, stress continues to be the main contributor to adverse health conditions. According to the Mayo Clinic, common effects of stress on your body include headache, muscle tension or pain, chest pain, fatigue, change in sex drive, stomach upset, and sleep problems. Common effects of stress on your mood include anxiety, restlessness, lack of motivation or focus, feeling overwhelmed, irritability or anger, and sadness or depression. Common effects of stress on your behavior include overeating or undereating, angry outbursts, drug or alcohol abuse, tobacco use, social withdrawal, and exercising less often. Any of these conditions can end up at doctor's offices or local emergency rooms with prescribed pick-a-pill solutions that rarely address the root of the problem. Small concerns become major illnesses as symptoms of stress, such as lack of sleep and decreased physical activity, have been shown to increase beta-amyloid plaque buildup in the brain, a key Alzheimer's biomarker. The ultimate financial burden of stress-related health issues is massive, and mitigating stress should be a focus of forward-thinking healthcare programming. Both music and meditation have been proven to have an enormous effect on managing stress. Building on established research in the neurological field, music and meditation can provide a new paradigm for long-term, efficient healthcare solutions. The process of medicalization is important as it helps to identify and respond to healthcare issues. But an awareness of options is needed, and it is an uphill battle against an established, monstrous money-making machine. Non-invasive, non-chemical, community-based, and artistically driven remedies are available. Positioning music and meditation as a lifelong commitment, providing solutions for stress relief, early childhood education, mental health, physical rehabilitation, community participation, and seniors issues could provide a cost-efficient, cradle-to-grave alternative to a needy healthcare industry.